Okay, we're recording. All right, well, welcome everyone. Happy Friday. It's great to see so many faces here today. For this hour and a half, we'll be talking about the recent recovery housing program, NOFA, put out by the state's Department of Housing. We'll kind of go through a high-level agenda here, but just wanted to introduce myself. My name is Grace Clancy, and I'm with the Fletcher Group. Also joined by my colleague, Milena Stott, here as well from the Fletcher Group. And we're partnering with Diana and Miguel with the Department of Housing to support them as they put this NOFA out and draw down dollars and work with all of the programs that are eventually funded. So that's kind of our role, and I'll go into that in a little bit. But for this hour and a half, we'll kind of talk about a little bit of background about the program and the funding itself, those different components, different standards in the industry of just being aware of, and definitions, moving on to kind of performance agreements and audit requirements, the application itself and what to kind of keep an eye out for, as well as talking through the scoring application and just kind of the things that just to be aware of, and then as well as other federal requirements of note. And with that, at the end of all of those pieces, we'll move into a Q&A portion and would love to open it up to everyone for questions. All right, and just to introduce ourselves, so here today we have the Department of Housing with Diana and Miguel. I don't know if you wanted to introduce yourselves and state your titles.
Hi, I'm Miguel Rivera. I am the Director of Housing and Community Development with the Department of Housing of the state of Connecticut. And I'm a practitioner within the Community Development Block Grant Program. And because the Recovery Housing Program is under federal statutes, under CDBG, that's how I am involved. But in regards to the services and the understanding of the program itself, that's why we have the Fletcher Group and Diana. So, Diana.
Thanks, Miguel. I am a housing specialist with the Department of Housing. So I recognize some faces and names on the call. Many of you know me from my work within the homeless response system. So I oversee our COC funded programs, and really happy to be assigned to the Recovery Housing Project, near and dear to my heart, and really excited to help expand the spectrum of housing available to folks in the state of Connecticut. So Miguel likes to say that he's the bricks and mortar, and I'm the program implementation for this program. And really happy to be working with the Fletcher Group, who are HUD TA providers. Their knowledge and experience is really helpful in standing up this program. So we're really happy to be here and happy to have you all. Thanks for joining us.
Thank you. Milena, would you like to introduce yourself?
Sure. Good morning, everybody. Milena Stott. I am the implementation advisor here at the Fletcher Group. I am a licensed social worker and drug and alcohol counselor by background, so share a lot of Diane's passion and experience in the space of housing. And then I also support the program development side of things and am aware of Medicaid and blended funding. So really help kind of put together the model, so to speak, for a successful and sustainable recovery house program. And I'll talk about what that looks like today for your application process.
Milena, thanks so much. Another one of our colleagues who couldn't make it here today, but he's a very important part of our team, is Mr. Grant Meyer. He's an urban planner by background and training. And he's very much alongside this work, but he couldn't make it here today. So, all right. Well, thank you all for those brief introductions. That's really helpful. To kind of taking a step back here, in case you're wondering the kind of role that Fletcher Group is playing in some of this, and how we might be working together in in the coming months and, the year ahead as well. We are a center of excellence with HUD and a TA provider on the recovery housing program. And what that means is that we work with states that have the recovery housing program. We work alongside them to help them implement the program, helping them find kind of local projects, getting NOFAs out there, driving best practices in that work, and providing direct technical assistance to the folks that are awarded funding to make sure that they're supported and set up for success from beginning to end. We also have a small research team. So if there's any kind of program evaluation type questions that come up, we are more than happy to talk through some of those things. All right, talking about the ecosystem partners. So there's a lot of different supportive partners in the state of Connecticut that intersect with this work, and just wanted to share a little bit about that. So a lot of these programs and systems listed here will intersect with the recovery housing program, or programs that are eventually funded from the referral side of things, either folks kind of coming in or folks, kind of referring out. The Mental Health and Addiction Services Department, so that's DEMIS. We have corrections and the court system. There's also the kind of broader housing system and homelessness networks there as well as a number of other partners. And so we just kind of say all of that to acknowledge that those ecosystem partners are really important to successful projects, and just being aware of that broader system will be important. And a little bit of the fun background about RHP. So RHP meaning the Recovery Housing Program. If I slip into acronym speak, I'll try not to, but if I do, you know what I'm talking about. So the Recovery Housing Program is a pilot program that was nestled within the Support Act from a few years ago. And the goal of that is to help folks with or in recovery from a substance use disorder become stably housed. And it authorizes a number of states to provide stable and temporary housing to individuals in recovery from a substance use disorder. This started out as a pilot program, but it has been reauthorized in 2025. So we expect to see this funding continuing in the future. And I'll hand it over to Diana or Miguel to talk about kind of the NOFA itself and what to expect.
Thanks, Grace. I'll take these next couple of slides. So we're going to talk a little bit here about who do we intend to serve with this funding. So the beneficiaries of recovery housing funding. Every program participant has a requirement that they are persons that are directly impacted by substance abuse disorder. So that substance abuse disorder has to be documented. Additionally, we're looking to serve folks that are low income. So we're thinking about federal poverty levels, folks that are insured by Medicaid. I believe we put language in the NOFA regarding area median incomes. There will be a preference for programs that are supporting folks that are living below 60% of area median income. So those are the folks that we're looking to help out with housing. The housing piece of this is crucial. Next slide. So these recovery house funds are federally awarded. The state of Connecticut has received just over $6.5 million. We're looking to dole out awards to about a handful of folks. There will be discretion for the award amount. So we haven't set firm limits on what you can apply for. We're really looking for folks that have given us, demonstrated that there's a high need within your community, and that you'll be able to plan and complete the activities of recovery housing in a timely manner. If you go to the State of Connecticut website, you can view the full NOFA, gives you all the information on the eligible activities that you can support with this funding. All of those eligible activities align with our state action plan, which you can also read through on the State of Connecticut Department of Housing website. Next slide. So this NOFA took a lot of work, but we were able to release the NOFA last Friday, May 22nd. So again, you can review the full NOFA on the Department of Housing website. And the timeline for the application process, like I just noted, we were able to post the NOFA on the website last Friday. We will be accepting rolling applications until July 31st. We're going to take a couple of months to review those applications and be very mindful of, reading through all of the very hard work that you all are putting together. These applications, we want to take our time. And we expect that an award will be made, or awardees will be notified and awards will be made by this fall. And so we want to talk a little bit about what defines recovery housing. Many of you are familiar with what is called a sober home and what sober homes are in the state of Connecticut. They must register with the Department of Mental Health and Addiction Services. They oversee the registry. We're going to talk a little bit, the Fletcher Group is going to talk a little bit about NAR, which is the National Alliance of Recovery Residences. There's a certification process that folks need to go through in order to become a certified sober home. Am I missing anything here? I think that's about that. We work very closely with our two continuums of care, along with Department of Mental Health and Addiction Services and the NAR certificate. In Connecticut, that is a CT Alliance of Residents, Recovery Residences, and I believe they may even actually be on the call today. And I think with that, I will kick it back to Melina.
All right. Thanks, Diana. We're going to talk about what makes a successful application and project right now. So starting with the recovery housing definition, Diana shared a definition that is important to your state and how Connecticut defines recovery housing. That is important to be aware of. This here is just a slide kind of demonstrating how the Support Act defines recovery housing. It's a definition that's available for states who haven't adopted a formal definition. The goal of the program, right, and what makes somebody eligible for the program is having that substance use diagnosis and qualifying from an income perspective. Somebody on Medicaid would qualify. The goal of the program is to provide stable or temporary housing for a period of up to 2 years, or until the individual secures some sort of permanent housing, whichever is earlier. And that's important to note because that's the outcome that HUD is concerned with. So when awarding the funding, programs are evaluated on their ability to exit people successfully into some sort of permanent and secure housing. All right, next slide, please. Diana introduced NAR. This is a national alliance that came together to basically define the standards and ethics of recovery housing, and they've set the standards. They've created certification processes, really looking at the best practices and what research drives the outcomes that we want to see. And so in that, they do a lot of training and promotion of what quality looks like, and really, ensuring accountability through ethics and quality. Next slide, please. Another important organization to note is the American Society of Addiction Medicine, and they joined together with NAR to develop a continuum of care that involves recovery housing. So the 4th edition for ASAM actually includes recovery housing as part of the continuum of care. and defines the services and the staffing and kind of the levels. And we'll talk a little bit about that in a couple slides here. That's important to know because ASAM drives a lot of funding, and a lot of states adopt the ASAM criteria when coming up with their state Medicaid plans in defining what the system of care looks like. So that they provide the guidelines, and similar to NAR, also do the trainings. They certify professionals rather than settings. And again, all of this is based on research that is focused on addiction care. Next slide, please. SAMHSA has a guide out there that defines the 10 best practices for recovery housing. You can see them listed here. You can access the guide. We can post the link in this chat or follow up with some sort of FAQ responses that would include the link. But really what they're looking for is recovery practices. The social model is center, that you're considering people's strengths and individual needs in the process, that your process is clear and trauma-informed based on research and best practices. So a lot of the same similar things that ASAM and NAR promote, but more of a toolkit on how to implement those best practices. All right, next slide, please. So here you can see this graphic. It defines the combined ASAM and NAR levels of recovery housing. So NAR used to call it levels 1 through 4, 1 being a lower level and 4 being the highest level. You can see here that they all, what they all have in common is that they are a sober living environment and that they use a social model of recovery support. As you increase in higher levels, you see more staffing, more services. So, in a level 2, you're going to see, or a monitored setting, you're going to see the recovery support services. In a supervised setting, you're adding the life skills, which is a very important component of the program, which we'll talk about in a little bit. Oftentimes, individual outcomes are tied to those program and services that are available for folks, and the life skills is one of the common ones. And then in the higher levels, you're adding the clinical services. So folks who maybe have a higher level of need are going to go into that higher level. Next slide, please. So this here is a graphic that incorporates the ASAM criteria and some information about it. What you're looking at across the levels, peer run all the way to clinical, is the governance and the staffing, as well as the services. So, in the peer run and monitored setting, it's more of the residents vote on a house rule, or in a monitored setting, a resident house manager has more say, for example, on who might enter the house and might handle some mediation or conflict that happens in the home. The services, typically include those peer support and life skills and mutual aid. In supervised settings, you're more of structured programming, sometimes built into the program and sometimes through partnership. And then in a clinical, you're probably operating more like a residential treatment program, like an ASAM 3.1. All right, next slide, please. So the reason why, recovery housing is on the continuum for housing in HUD is really that it's a gap. It addresses a gap between homelessness and permanent housing, and focuses on providing a structured environment for folks that choose that setting because they know that they need that community to support them in their recovery. They've had experiences in other settings where the milieu or community or setting was maybe perhaps too triggering, and didn't have the structure that they needed. So folks who are seeking these environments are really looking for those sort of things. And it's important to talk to people about their goals and, making sure that this is the right setting for them. And recovery housing really aims to lower costs by using resources efficiently, by providing people the support they need in their communities and utilizing clinical services as the need becomes available. And it's focused on, person-oriented strategies that respect the choice of the individual to be there and their recovery goals. Really focuses on a successful exit strategy. This is probably one of the core components of recovery housing that makes it successful, that folks who enter come in wanting this kind of life skills and community support so that they can regain employment and income and then move, into housing. Folks with higher medical needs can be successful in recovery homes, provided that there is planning around the services. And so that's the importance of kind of paying attention to the different levels and the individual needs. All right, next slide, please. So recovery housings operate within a recovery ecosystem, right? Oftentimes folks are either walking into a program because they learned about it through a member of their community, or they're being referred through the criminal justice system. And there are many programs connected to the criminal justice system, or treatment providers, or they're coming from a withdrawal management program. But the idea is that this recovery house doesn't operate in isolation, that there's strong connections to a referral system that is supporting that individual in getting access. And then once they come into the recovery home, they're getting case management and peer support and help with finding stable housing and education support, or case management to get them to those physical health or mental health services. But the core focus of the program is really that life skills development and that employment support as individuals are kind of progressing towards independent living and permanent housing. And of course, at exit, it's important that folks are connected to employment, transportation, housing. Remember that HUD outcome is successful housing. And then have that social support in their community. Many communities have recovery community organizations or recovery cafes or different ways for folks to get involved. But we find that connecting folks on the outside is equally important. And so this graphic here kind of represents the process and some of the partners and some of the services that, one might encounter. All right, next slide, please. In a recovery ecosystem, this really kind of talks about the types of partners that are common, right? So you've got your community. Community stakeholders are really important because support for recovery housing in the community has to be engaged sometimes. It has to be taught. And then we engage individuals both into the program and the community at large to support the program. We engage treatment providers who serve individuals in recovery homes, because typically recovery homes don't have that staffing of a licensed mental health counselor, for example, or a medical doctor. A big important partnership is medication-assisted treatment. There are many folks who come into recovery homes who need that, and they may need help accessing that or managing that within the community. Again, employment is a core focus. Vocational training, life skills training, really giving folks what they need to succeed once they leave the program. And then, of course, some sort of collection of data. And we'll talk about that, related to the application process as well, and data and reporting. But really what we're interested in is proof that it's working, because if it's not, we want to ask the question of what do we need to tweak to improve that outcome? Is it another service? Is it changing the model in some way? So that's why we include that there. All right. Next one. So who participates in the recovery ecosystem? We talked a little bit about your local partners and folks that have been engaged, either to support the writing of the action plan or to work with Diane and Miguel on finding potential applicants. But this is just a list of some folks you may want to engage in the process, or services that you may want to consider. because these things often go hand in hand, or these systems touch the program or individuals in some way. Yeah. Next slide, please. So I'm gonna, Diana talked about working with the COC a little bit. So I'm just gonna reference here that recovery housing, operates in the state of Connecticut within a continuum, and that Connecticut is aware of the needs of folks and collecting data on those needs, and writing applications for program funding for that. Really interested in flexible policies that allow individuals to have their needs met across their housing settings, and just really looking for that if the recovery house setting isn't the right setting for individuals, that there are efforts to be made to find those settings in collaboration with coordinated entry and other homeless services. And then again, just the keynote there that making this available to folks that are looking for this type of program is very key. There was a lot of analysis done nationally to kind of look at the gap analysis around, recovery housing. And, we've seen many states expand their capacity for recovery housing, which is fantastic. Next slide, please. So how does it all work? So I'm going to kind of give you, this is like the swim lanes for folks, right? So HUD has set the goals for this program: stable transitional housing for folks exiting in recovery for SUD. The state of Connecticut has developed an action plan, which, Diana referenced, which is available for you to see, but it basically describes how the funds will be used, and how you'll be selected to receive funding based on the alignment with that action plan. And then your application. So you're awarded funding based on your ability to demonstrate that alignment, communicate, the gaps in your community, and communicate how your program is the best program to address those gaps. All right, next slide. Let's skip this one. So the general application process you'll access through the website. I'm going to talk in detail about the project narrative here in the slides to come, but you will see what the application packet includes once you click on the link. And I don't know if we want to put that link on the chat or if that's been done already, but that way we can make it available to you. All right, next slide, please. So there's multiple partners in one goal, and we talked a little bit about the role of the state and the sub-awardee. This kind of goes into a little bit more detail. I'm going to focus more on your role here because you're going to be applying. But if you want to reference the slides for the state's role, it's really just how they support you in your role. Next slide, please. All right, so the application is your program blueprint. So I like to tell folks that if you're building a program now, you're probably too late unless you're a part of a larger organization or partnership, because a lot of these things often take time to put in place. But there's also ways to leverage work that has already been done. And so if there's questions about any of that, we have toolkits and some references for you around that. So we're going to talk about the different components of the application, which focus on the need and design and the housing quality. And so that's your actual program. Then we're also going to be interested in partnerships, how you're leveraging partners and resources, because recovery housing operates in a blended funding kind of community partnership model. Because as we learned about the different levels and different needs, it often requires local support, especially around zoning and development and those sort of things. And then, some capacity and readiness on your end, right? So being able to spend the funding in a timely manner, and that often means, having staff that are trained, having some sort of vision for what the long term looks like. And now we're going to dive into each of these components in greater depth. Again, here's the active ingredients. The dark blue ingredients are really about the population and design. The red really focuses on safe housing and partnerships, and then the blue is kind of your coordination. Next slide. So in terms of population need and profile, there are likely state reports and local reports around substance use needs. To the extent that you can zone into local needs using local data, that is desired in an application. There are ways to access this data, and we're happy to provide resources that we have around access to data, but your local public health agencies or your local service agencies often have this information. You'll want to explain how that data shapes your target. And the more you can kind of zone in and define that, the better. But really what you're trying to articulate here is that there's a need. You have to have data to say, like, recovery housing is needed in our community. And that's important because if there isn't a need, you're not going to be able to fill it and your program's not going to be successful. And so in terms of a pre-development action that you can do, you can review or conduct a community needs assessment. All right, next slide, please. So in terms of program designs and outcome, it'll be really important that you talk about your logic model. Your logic model describes basically how your program results to the outcomes that that your program produces. And so within that, you talk about things like how the residents are supported, how services are offered, and how those services lead to housing stability. Within that process, you might want to identify key partners and roles. Because there's a component about partnerships. So if they come into your program design, oftentimes, recovery homes have a partnership with an MAT provider and a mental health provider. And then you'll want to talk about your outcomes, how you're defining your outcomes, how you're tracking how long people stay there and how they exit and where they exit to. You'll want to describe, your system of how you're collecting that information. So in terms of a pre-development action that you can do, you can draft your logic model and identify your data systems early, so that you're able to report. All right, next slide, please. So this is really about need again. So the location is important. We think of location both in terms of an area of need, but then in terms of access to transportation, access to services, walkability, that sort of thing. Sometimes fair housing comes up, like we've heard of, zoning requirements that get put forward in front of people. And so when you're picking your site, you'll want to look at those risks, right? You'll want to address whether it's a favorable site. Is it a high drug traffic area? Is it, what are the things you want to pay attention to in terms of location? So a pre-development activity that you can do is a site analysis, right? Where you're looking at the service proximity, as well as, is it a place that people can access and there's a need in that area? All right, next slide, please. So safe, healthy living environment. This is really where you're going to pay attention to the NAR standards and the HUD requirements. NAR has laid out a set of standards that Connecticut uses and follows in their certification process. And HUD also has requirements. You'll want to make sure that your health and safety policies reflect those requirements, that there's naloxone and MAT access, that the residents have rights, that when a recurrence happens, there is a process that is focused on helping them achieve that next step, whatever it is chosen to be. And so you'll really want to focus on how your program supports your safe and healthy living environment. So a pre-development action that you can do to prepare for the application is review the NAR standards and draft your house rules and resident rights policies. And the Fletcher Group can provide toolkits and guidance related to some of these things that we're talking about, the community needs assessment and the policies. All right, next slide, please. So leveraging partners and resources. This is where, like, if your program can't address everything that the person needs, you'll want to consider partners that are able to support them in that. Common partnerships that we hear about include local community colleges or GED programs. You know, they often have funding or will send folks. Financial literacy classes is another big one that we hear about. You know, I talked about the MAT providers and the health services providers. Those are common partners. Partners are also referral sources. So people who trust you and that you trust, that together you're working to serve individuals, that there might be a local residential facility or withdrawal management program that you work with, and folks exit from their program into your recovery house. And to the extent that you're working with those partners, you know, to the extent that there's MOUs in place or letters of commitment in place, those can help your application process, right? Because we know that if you're serving individuals who have those needs, those services become necessary for you to meet the outcomes. Thank you, Diana. I keep saying MAT. And then it also, it's written medications for opioid use disorder, but yes. MAT is medication-assisted treatment. All right, next slide, please. Oh, okay, so sorry, pre-development activity, you don't have to go back. Pre-development activity there was kind of develop your list of partners and start to have those conversations and get those letters of support and those MOUs in place or that sort of thing. So community support for recovery housing. So NIMBY, not in my backyard, is a thing that comes up with recovery housing. And again, this ties into that site selection. Okay, because if there is not support for recovery housing and you have to go through a process, that's going to affect your timeline and it's going to affect your ability to obligate the funds, and it may just end the project altogether. So you just want to be aware of support for recovery housing. It's not a deal breaker. There are ways around it. There is coaching and support available for it. We do it nationally for programs when it comes up. I'm not going to say it's always easy, but there are solutions. So related to just kind of that community engagement, you know, you'll want to describe your outreach efforts, letters of support. You know, if you've identified like a risk, you'll just want to talk about how you're addressing that risk. You know, recognition around fair housing obligations and things like that. And then when there's oppositions, like how are you going to build your engagement strategy? So a pre-development activity to do there would be to begin the community outreach early and, you know, look at what your support is. That may be in terms of just letting the program exist there, but it may also be in terms of funding. They might even want to support you from a funding perspective if there is support. We've seen that too. We've seen local governments donate buildings or land or space to help a project along. All right, next slide, please. So coordination with government agencies and providers. I guess that was a good segue around government agencies donating funds. government agencies pay for funding, they operate human services, you know, they have leverage in communities. So really kind of coordination with those folks and how you're coordinating with them. They are often connected to the COC priorities and all of those strategies. Being connected or aware of those conversations can be important. You know, some of this depends on whether you're a small scale or large scale program, because we have recovery homes of all sizes. You know, a smaller recovery home may not be as deeply engaged at this level, but a larger program might be. They might even be receiving referrals, right, from local government programs. So related to this, you know, your coordination with providers, you'll just want to talk about what's required for people to enter your program. You know, what's your intake and referral process? How is your program embedded in a broader system? And so a good pre-development activity is just to attend a COC meeting, or, you know, get on their email list, start to become aware of the local efforts, because they get a lot of the funding and are in charge of a lot of the system coordination around housing. And our goal is to get people to the right place. All right, next slide, please. Readiness to obligate funds. You know, a key situation here is you have control of the site. You have a lease, you have a deed, there's an agreement, there's a letter of intent. The zoning has been addressed. Your environmental review has been addressed. And I know Diana and Miguel can provide great support and guidance around environmental review. So in this section, really the concern is how quickly can you spend the funding and what are the milestones until you get that first resident into the treatment or the recovery bed. So a pre-development action would be to get a site and confirm the zoning before submitting your application. All right, next slide here. Trained staff and peer support. You know, this is really looking at like the level of staffing related to the level of recovery house, and then how those staff are trained. So common trainings may include trauma-informed care, de-escalation, ethics, motivational interviewing, those sort of things. Peers often have required state training as well. And so a pre-development action would be to identify peer support staff and develop supervision and training plans as you think about their role and what they need to be successful in that role to operate your program. All right, next slide, please. This is where we're looking at capacity and sustainability. And I think that this is where we can offer support as well. But you'll really want to talk about, you know, the current projected funding sources beyond RHP. So if RHP is the bricks and mortar of your program, how are you leveraging other funding to make sure those service components are taking place for the individuals residing there? And so what would demonstrate this would be long-term contracts or agreements, knowledge of funding and funding relationships, organizational experience in accessing and managing those funds. So a pre-development activity that you could do for this would be to map out the funding landscape, and then identify gaps that new partners or applications would help you address. All right, next slide. All right, home stretch here. So putting it all together. So really there's three big components if you kind of want to break it down. There's the needs assessment, which you're looking at the population needs against the program design. Okay, you want to make sure that your program is designed to meet the needs of those people. So if you're like a level 1 house and you're serving people with co-occurring disorders, you would need a partnership, right, to serve those folks well, to make sure that they're engaged with the right services so that they can maintain stably housed. So you're looking at how my program design is addressing the needs of my population. And then the location, like does the location support the program and the population? So are the services they need accessible at this location? And if not, that's okay. Are you able to provide transportation? What's the plan for transportation? Some folks use telehealth as a solution, right? So just different ways to address that. But you'll really just want to kind of map the treatment capacity and the housing supply and how your program fits within that. The environmental scan, there's an environmental review, not to be confused with the environmental scan. And we'll talk about environmental review soon. The environmental scan around partners and community support, and then the site, right? Is the site appropriate? And then in terms of your business planning and sustainability, there you're focusing on the staffing and the long-term funding. And so below that, you can see the key action plans around pulling the data, mapping the providers, confirming the site, building the org chart, and finding the gaps and how you address those gaps. I think that's it. I don't know if we want to pause for quick program related questions before we go into federal compliance things that I think Miguel will probably talk about. Are there any quick questions? Or maybe put them in the chat and we can decide to answer them. But I just want to take a quick pause because I know I've been talking a long time. All right, I am not hearing any. So the key takeaways before I turn it over to Miguel is that the active ingredients are not just application considerations, they are foundations of excellent programs. So that's kind of what's been laid out to you. You know, the state is your partner and the Fletcher Group is here to support the state, and then folks that are awarded federal funds can receive support as well. Pre-development work is really important. So the key takeaway is that if the timing isn't right, those pre-development things are things that you can start now and, you know, build from there.
Lena, it looks like we do have one question.
All right, let's hear it.
Rick, please unmute yourself.
Yes, thank you. Thank you very much. So through this process, is there somebody that can, you know, answer questions, we can email them any questions we have? Because I've been through other processes and there's no help. And, you know, I'm a guy, I could build anything, but, you know, filling out an application of this magnitude would, you know, be really hard.
Yeah, and thank you for saying that about the applications. I didn't mean to overwhelm you with the information. Not all of that has to be done in great detail, right? Some of the best applications are shorter, they're just precise. So what I tried to offer was like the bullet point, right? That if you can use that as an outline, you know, to kind of start linking websites or information that you have, you know, that's ideal. Here's what I'm going to say. A lot of organizations have their programs written and they're waiting for the funding that meets their program. So if there's questions about the process or resources needed for the process, we have toolkits, and there's probably an FAQ process. We may decide to hold office hours, if that seems to be needed to answer collective questions. But I think we're interested in supporting successful applications. I'll say that. And then I'll let Miguel and Diana kind of answer more about their FAQ world.
I was also going to add that, Rick, at the end of our slides, we have a contact slide that we will kind of hover over. And then, Diana, if you're able to maybe paste your emails in the chat as well, just to make sure that folks are able to grab that, that'd be great.
Wow, I feel a lot better. I feel a lot better. Thank you. And will this presentation be available to us?
Yes, it will. We'll have the recording posted on the website, and I think, Diana, you can let folks know where to look for that.
Thank you very much.
Great question, Rick. Thank you.
And Rick, the Fletcher Group has toolkits from the HRSA side of the house and does work in rural communities. So if you happen to be a designated HRSA rural zip code, there might be other ways to support rural work.
Amazing.
All right, I see there's another hand up. I think is it Terry?
Yeah, hi. Can you hear me?
Yes, we can hear you.
Okay, so as I went over the qualifications of doing this grant, I noticed with other grants, they will tell you, it has to be a certain way, 10 pages only, not counting the, appendix and extra papers you have to put in to prove zoning and all that. I did not see that in here. That's one question. The other part is I'm a 20-year-old program. Now, so sometimes old school, with the new stuff, but I was always told that you could not do clinical services in a sober house. So my concern is some new people heard you speaking about the different levels of a recovery house. So is this for treatment centers too?
So a level 4 would qualify as a treatment center by definition. And to that end, then you're subject to all of those requirements and Medicaid rules, right? In terms of how long people can stay there. HUD would be concerned with your ability to discharge people from that level of program into permanent housing within the allotted time frame. So all that to say is you can't let medical necessity be the driver of how long they're staying there. That HUD is paying for housing and that Medicaid is paying for services. So the funding can be used to build a bricks and mortar of a clinical setting.
So yes, this is also for treatment center too, not just sober housing.
Provided that the treatment center is housing, that the program is housing centered and that the treatment is secondary, right? So you're not being admitted into, you're being admitted into a continuum of services. So if treatment is part of the stabilization process, you can't have them exit because Medicaid or whoever stops paying. The only way you can exit is if they go successfully into permanent housing.
And sober housing would not be considered permanent housing, so that treatment center couldn't say transition to a sober house. Gotcha.
But the sober house could. I mean, you could transition them from your treatment center to the sober house, right? Provided that when they exit the sober house, they're exiting to permanent housing. But again, the ultimate metric, right, is that exit to that, is that outcome of successful housing. So that's what everything is based on. So if you're going to blend funds, that's fine. You just have to be very, very clear on that kind of phased approach and what funding is paying for what phase.
Got it.
Okay. I know it's complicated. I'm glad you got it.
All right. Miguel, would you like to talk through a few of the federal compliance components?
Yes, and thank you very much. I know we're throwing a lot of information. Please remember that this is being recorded and that you can access that at your convenience. The alpha and the omega. Before you take any actions, we are available to discuss with you and provide appropriate guidance. But the alpha and the omega begins with the environmental review process. So all recovery housing program activities must comply with the National Environmental Protection Act and HUD regulations under 24 CFR Part 58. Because it's under the CDBG program, we actually do have a guidebook for the CDBG environmental review process. It's a PDF and it's available to you free of charge, accessible. We'll email it to you directly at your request. Plus, there are resources that I can guide you through called the HERO systems, the HUD Environmental Review online system. An environmental review must be completed before construction, rehab, or other choice limiting actions. And we're going to put a pin on choice limiting actions and we'll go into depth a little bit more. But basically what that means is, just like in the game of Monopoly, do not pass go, do not collect $200. Funds cannot be committed until HUD issues an environmental clearance. Basically what that is, we go through an environmental assessment, we do a public commenting process, we do a request called an request for the release of funds, and then we receive an authorization of grant funds. It applies for acquisition, rehabilitation, and construction activities funded under the Recovery Housing Program. To be quite honest, it applies to everything. So that means there are different tiers in the environmental review. There are exempt activities, such as, well, what is an exempt activity? That means management, review and research of funding, working with a consultant or an architectural team to do design reviews and cost estimating. There is pre-development that would fall under the not subject to review. And obviously acquisition, rehab, and construction would fall under the subject to or the environmental assessment. Projects have to comply with the 24 CFR rules.
Yes, you do have a choice.
Diana, you need to mute. Projects must comply with 24 CFR Part 58. Offering requiring that we have ideally a local government, but the state will stand in the place of working with the smaller municipalities as the responsible entity. Next slide, please. Or can I control the slides? Okay. If you have an existing facility for the protection of the individual residents, along with your staff, we're going to look at hazardous materials. And those things include lead-based paint. It includes radon, asbestos, underground storage tanks, and nearby contamination, not just within the property, but near the property. We're looking to make sure that, we're not setting up shop next to a situation where there might be a commercial corridor that has had a lot of contamination spills that could impact the habitability of the property. We are also looking at the fact that I've had questions, oh, well, what if it's an all-male facility? Well, does that include your staff? And with all respect, does that include any visitors to the facility? So if there are children that might visit or an individual who could be pregnant that might visit, we are taking lead paint seriously. This is for the protection of the individuals, their families, their friends, and your staff. Next slide, please. We also require compliance with the American with Disabilities Act. We look at common issues from non-compliance with regards to accessibility of bathrooms, kitchens. As funny as it sounds, we still struggle with making sure that we have the right height on a toilet in projects across the state. But we're also looking at kitchen accessibilities. If people are able to prepare their own meals, we want to make sure that we have a kitchen that is accessible for individuals in wheelchairs or utilizing mobility assisted devices like walkers. So that's something that we will make sure to discuss in your design if a kitchen or bathroom is part of the renovations. Faith-based organizations, common issues resulting that an ineligible status include recurring clients to attend faith-based meetings. So I believe the term is protasticizing. So you can believe in a Holy Spirit, someone above you and above you. And I'm going to put my foot in my mouth and I'm going to say it like it is. And I'll paraphrase the Bible. Jesus was asked about the relationship of government and the God. And he responded simply, I believe, in a way that it was, render unto Caesar what is Caesar's and render unto God what is God's. So in this particular case, we can't mix the two. We are talking about Caesar. We're talking about government funding. We can't mandate the recipients of the assistance to be required to participate in a particular faith activity. Next slide, please. Procurement. As nonprofit organizations, many of you, or maybe quasi-organizations, many of you have your own procurement requirements. Please review those requirements. Be familiar that you can't just go out and solicit bids from organizations or entities that you've done business with before. We have to go through federal requirements under 2 CFR Part 200. And again, we can provide you guidance under those requirements, but more than likely, you will, depending on the size of the project, you will go through a full and open competitive process, open bids, and will also be triggering Davis-Bacon prevailing wage requirements. So, things to keep in mind. So sorry. Contractors and vendors have to be licensed and insured. They must not be barred or suspended. We've had recent situations with individuals working with, long-standing relationships, and those people were not licensed and insured anymore. Conflicts of interest must be identified and in all cases avoided. And subrecipients must adhere to, as you can see, 2 CFR 200, promoting open, competitive, so that we are looking at the inclusion through our Commission of Human Rights offices, ideally working with minority, women-owned, veteran-owned, and a small business opportunities. Next slide, please. Is there another slide? Okay, thank you. Section 3. Well, besides going through the good faith effort of assuring that we have an open competitive bidding process, Section 3 basically is a law requiring that we also track those efforts and ideally the time and funding that low-income residents had the opportunity to work on the project, what they were paid for on the project. These are reporting requirements for the CDBG program. If you have an existing property, be it that you're going to make expansion renovations or that you're going to be acquiring a property, If you have residents, you will be required to review the Uniform Relocation Act. This will be applicable to all projects. I will hold on that question in the chat for a moment. Thank you very much. Citizen participation. Again, we will support you through this process. Many of you have not worked with the Community Development Block Grant. It's very flexible, but it does have a lot of hurdles, I'll be honest. But we have guidance to help you go through a public hearing process. They can be virtual now, and that would allow us to be able to capture enough public comment, participate in community participation. Next slide, please. Labor standards, as I mentioned, Davis-Bacon, prevailing wages will be triggered. At this point, if there is no other state funding tied to the projects, we do not anticipate state prevailing wages requirements, which is a good thing because in the last couple of years, state prevailing wages have gone up significantly, and somewhere in the ranges of 300%, depending on the labor classification. Davis-Bacon, we lock in rates, so that gives us more stability in regards to the project funding and cost. Next slide, please. Baba. There was a time where Miguel would say Baba at least 3 to 5 times a day in different meetings. Baba right now on current laws and regulations is the Build America, Buy American Act, put in place by the Biden administration. There is current legislation being reviewed that potentially could rescind the applicability of BABA. We will keep you informed as we progress with your projects. But basically, the concept is very simple. Buy American-made at this point in time. We're going to buy American-made products and materials for the construction of infrastructure, and in the wisdom of our political leaders and administrators in Washington, D.C., an infrastructure project currently does include acquisition, construction, and rehabilitation of housing. Next slide, please. As you can see here, with regards to BABA, the long and the short of it, we are going to be presuming whichever funding, because we have multiple years of funding that do go back to 2024, that we will be utilizing the BABA requirements, because there will be, depending on the number of projects, we will use funds from various years. So again, at this point in time, until further notice, we are requiring BABA, the Build America, Buy America program requirements for materials and constructions. Next slide, please. Audit requirements. Please speak to your CFOs, your financial committees, with regards to your experience in receiving of federal funding. If you have not, please reach out to us so we can provide you additional guidance. But very quickly, a non-federal entity that spends $1 million or more in federal funding during its fiscal year must have a single audit or a program-specific audit for that year, in line with the rules in this part, which is, as you can see, CFR Section 2, CFR 200-508. This is sometimes a burden to organizations financially, because that's not something they typically budget for. So we want to be eyes wide open, forthcoming as to the understanding of your fiscal responsibilities. So again, you can forward questions and we will do an FAQ and respond appropriately as to further audit requirements. Next slide, please. Assistance performance agreements. Even though these funds would be put out as a grant, they would be conditional grants. They're not straightforward. Congratulations, here's the money. There are conditions. Begins after the award. So there'll be an application, there'll be an award, and during the awarding process, we will assure that we will provide guidance on compliance and monitoring terms in regards to the type of project that you apply for. It will include contractual requirements, the scope of work, and budget. We will be doing site visits before the selection of projects so that we can really be on the ground with you to understand your vision, to identify. Ideally, we want to try to have no change orders. We want to know all of the obstacles ahead of time. We want to have X-ray vision. So a best practice is for us to do a walkthrough and site visits with you. And we do have templated reporting documents that we will help you with additional instructions. And we will make sure that, again, we provide you information in a way that is completely understood by yourselves, your board of directors, and your program staff who will be implementing and working on these projects. Next slide, please. Performance monitoring and reporting. We'll include information on the measures and the programs and the objectives here. Typically, these reports will be done on a quarterly basis. It will include information on the frequency, and as I said already, the frequency of the monitoring and reporting will be quarterly, and will include any forms. Again, we have templated documents that we will modify and include, in a sense, label them for the recovery housing program. Next slide, please. Okay, any questions? At this point, we're going to take the chat questions first before we take any live questions. And do I go into the chat and pull the questions? Okay.
Hey, Miguel, I think there's one in here that I haven't been able to answer just yet, posed by Terry Keaton. Do you need to own the property or can you just have an MOU with the owner?
We don't call it an MOU. So I just want to, what you're going to need to do is you do need to have site control which could be a purchase option agreement or a purchase agreement. So you do need to have something. An MOU itself, I don't believe would be sufficient. You would need to have something a little bit more substantial, like a minimum an option to purchase. Think of it as buying a house. You're making an offer. So now you have once the offer
And thank you so much. This presentation has really been excellent. Thanks for taking the time, guys. I found it super informative. Miguel, one of the strategies that we've used in other types of projects is a master lease situation. So we're working with a local landlord who owns the property, and then our organization would take out what we call a master lease. So we would lease directly from the landlord for a period of time. So the master lease may be 12 months, 24 months, 48 months, even as long as we have a 10-year one. Is that something that would be okay in this particular arrangement if we were the master leaser?
What are you proposing as a project? I hate to say this, I'll give you the human resources answer. It depends.
It depends. It depends. It depends. We weren't I don't think we're proposing to purchase property. I think we're proposing rehab of an existing property. And
Okay.
as a master leaser, we would be responsible for the rehab.
Yeah. So we have to look at it a little bit more closely because of the fact that who the recipient of the funds are, how your master lease agreement is structured as to who's responsible. Because at the end of the day, think of it this way. This for-profit entity is a private owner, and if depending on the renovations that you're requiring, they might be required by law to do those renovations already.
Okay.
And they may not be an eligible recipient of the funds.
Okay.
And it has to be new beds, right? So the rehabilitation would be, how is it adding new beds for people in recovery?
Thank you so much for adding that. Again, adding new bed, adding capacity. I see another hand raised from an F&D. I don't know who that is, but if you'd like to unmute yourself, please go ahead and, oh, your hand went down.
That was me.
Oh, that was you. Okay. Okay.
Thanks for the question, Finn. A couple other things over here in the chat. Thank you, Sarah Pavone, who asked a question on prioritization of folks experiencing homelessness. It is not a requirement for this funding. However, I do see that if you chose to go that route, it might strengthen your application based on community need. So demonstrating the need in your local community. Certainly you can use PIT data and that type of data to demonstrate what the need is within your community. And along the same lines, question regarding mandating the use of HMIS data entry. HMIS is not a requirement, though you would be required to have some kind of data tracking system. Few more questions over here. Is there a deadline for the LOI? Remind me what LOI stands for.
Letter of intent, I'm guessing.
Thank you. Yes. So we are accepting applications through July. The letter of intent can be submitted to Miguel and I anytime until then. Miguel, do you have a preference for the format for the letter of intent?
We can provide a format, but no, not really. It's really hi, we're interested, or we have an intention. I'm not gonna hold you to it. Just let us know that you're interested. And it's okay that if you identify an initial project, but it changes and manifests into something different, you don't have to put another letter of intent in, okay? So just, hi, we're interested, here's what we're thinking, and that way we can have an understanding and we can start thinking about how we allocate funding, and we can have good open and honest conversations with you. I see two hands up, and I'm trying to see your name.
Looks like
I think
Kathleen.
Kathleen was first.
Yeah, and then
Kathleen.
Kathy second.
Yeah.
Hi, Miguel. How are you? I did ask a question in the chat, and I just want to ask a follow-up to it. The proposed applicant requirements, it does say that, in addition to being a 501c3, that you should be an owner or operator of a certified sober house, that you should operate this house for a year or more and have the NAR certification process at least once and own the property for which funds are being requested. So I'm just a little confused by that. We do not have a sober house or a recovery house. However, we do have ASAM treatment programs. And we've been, working in behavioral health and recovery space for years, but it sounds like there's some confusion about whether that's a requirement or not.
Diana, is that related to the the rental assistance pathway rather than the rehabilitation or new construction?
Yeah, I think so. So the eligible expenses for these funds could be that you're acquiring a building or rehabbing a building, but could also be utilized for rental assistance for folks that are already operating a sober home.
Okay, so it sounds like in order to be eligible, you need to already be running a program and have the certification.
So we will take into account folks that are in the pipeline, are working on becoming NAR certified or have, years of relevant experience in recovery supports. All of that will be taken into account.
Okay, thank you. I appreciate it.
Mm-hmm.
Please understand that before we take Kathy's this is a federal program. The federal government created it. They said Connecticut qualifies for it. We've gotten some direct entitlements. We did not apply. We did not structure this. We are not trying to layer other requirements than what the federal program is structured. We're trying to keep it so that we're meeting the requirements of the federal programs. We're not trying to overcomplicate it and add state-specific requirements.
Well, Miguel, so the state of Connecticut, though, has defined recovery housing, right? And the one thing I will say to the treatment provider folks is ASAM defines this in their continuum of care, and that's something that you are familiar with. What I want to be clear is that this is more housing than program, right? And so programs, residential programs, are subject to medical necessity criteria. This is housing. You cannot ask people to leave when medical necessity is no longer met. It is housing. You can have them leave when they exit to housing. So just to be clear, it's not that treatment is exempt or that residential treatment facilities are exempt from the construction side of things. It's that your model has to account for that.
Thanks, Milena. And I think we have time for one more question. So Kathy, would love to have you share your question to the group.
Thank you. The timing on this, presumably we don't need to do the environmental review before we submit our application, right? We can include it in our timeline, but we wouldn't incur the cost of an environmental review until we know if our application was successful. But I just wanted to double check that.
That's a good question, Miguel. Can it be can any pre-development work be a part of the application process? Like
pre-development work, yes, pre-development
from a funding
work
request, right? So like
yeah.
For an environmental review, they could apply for what it would cost to conduct that as part of their process and define it in their timeline.
Yes, and what we can do, if people like, once we hear from you in your letter of interest, we can do a one-on-one call with you, or we can do a quick little update, and we can walk through. The biggest thing is coming to a project description. It's the alpha and the omega, and identifying the activities that you're thinking of going through. And what we do is almost a tiered or a step review, so that we can clear the exempt and not subject to activities under one format. And that would cover the environmental review, any pre-development type of things. And the cost of those pre-development can be reimbursed through the program. They are eligible soft cost. One thing that I can also look and explore with Diana is about pre-development funding capacity. Once we kind of narrow down projects, because we don't want you to unnecessarily spend dollars, but we do understand that some of these projects could be in larger scope. So we want to be able to support you that way. And the department does have pre-development lending capacity for nonprofit partners. So more to come on that, and happy to have those conversations.
So is it fair to say that based on the letters of interest and the questions that come in, we could schedule follow-up sessions as groups, right, in an FAQ, or individual kind of consults where we look at those, in more detail? Because the interest is to partner in a successful project, and offer support where all of the guidelines and stuff begins to weigh on you, so that you don't feel like you're swimming through muck, and that you have support in all of that. And it sounds like financial support even in some cases for pre-development work.
All right,
Correct.
wonderful. Well, we're coming up at the top of our time here today. I know Diana had put her email in the chat for kind of follow-up questions. And then Diana, if you wouldn't mind kind of sharing where this webinar will be posted, and where folks can find the NOFA if that hasn't already been shared in the chat. Thank you.
Yeah, absolutely. I did post a link to the Connecticut DOH website. Funding opportunities is the location of the NOFA, and you can review the full NOFA there, as well as our action plan. As we start to receive questions in email, both Miguel and I will post the responses to those questions along with the NOFA on the website as well.
All right, thank you so much. It was great to have everyone here, and thank you for your time, and wishing you all the best as you pursue your next steps. Thank you.